Hello, I'm Dr. Paul, and I wanted to introduce you to one of my patients, Olivia. Olivia had come in with some very severe vertigo. She had headaches and dizziness, and actually, you know what, let me go ahead and have her kind of explain all the symptoms that were going on, because there's definitely more than one symptom going on, and we'll let her tell you.
Yes. The onset of the vertigo was sudden. One morning when I had awakened, I attempted to get up. I stood up, and the vertigo just began suddenly and very strong, very severe. It dropped me to my knees. The whole room was spinning. I felt like I didn't have any control over my faculties. It felt like my eyes were just rolling. I had nausea and a headache, and when I finally was able to sit up, I made my way to a chair, and I had to sit there for over an hour before it stabilized. But after that, I continued to experience the vertigo for several days, several weeks, and up to this point, it's started to improve with the treatment that Dr. Paul has been giving me.
So when we first started, when you came in here, we went straight to, you know, adjusting the neck, getting the pressure off the brainstem, restoring more nerve flow and blood flow to your brain.
Yes.
How did you start to feel after you started getting treated?
I started to feel better. The vertigo started to subside, but it didn't completely disappear.
Right, right. It started to fade away.
Yes.
And your heart palpitations, too, they started to fade away.
That started to fade away. The nausea started to fade away. And the dizziness, the spinning of the room started to fade away.
Now, bringing you up to date, you know, how are you feeling with your heart, with your headaches? You know, what kind of life do you have right now?
Okay. I'm getting my life back now. With the vertigo, my life just stopped. I was basically like a shut-in. I could do nothing. Now I'm able to resume my life. The heart palpitations have ceased. The headaches have ceased. The vertigo is virtually almost completely gone. And I don't have any nausea, so I'm able to resume my life. I'm living a normal life again.
And the whole reason for this video is to help people understand, you know, you don't have to be taking prescription drugs. You don't have to go through, you know, medical treatment for situations like that. Chiropractic is more than just, you know, helping neck and back pain. The body works as a whole, and getting the pressure off with Olivia allowed the body to heal itself. And as far as people, they're not sure about chiropractic. They're, you know, some MDs have said it's unsafe, or I should say some, most of them, or there's just, you know, they're kind of a bad rap, if you will. What would you say to the person considering it?
I would say that I would definitely try chiropractic care. I'm 63 years old, and I've never felt better in my entire life. In my earlier life, or my earlier years, I sought, you know, the typical traditional medical treatments, and I used prescription drugs, but none of that helped. They were temporary fixes, which really only created more problems. They compounded the physical problems that I was having, and it wasn't until I started seeking chiropractic care. I was basically desperate, and it turned out to be the answer. I feel like my health is restored. I feel wonderful. I feel so much younger now than I did when I was in my 30s and 40s and 50s. I feel that my health is very good. I feel that my mental health is very strong, and I would recommend chiropractic care to anyone and everyone. I think it's the only way to go, the best way to go.
Well, I think that says it all right there. You couldn't be more complete and direct with that. I mean, that's what I hear from all the patients is, you know, they're going around in a circle and waiting to find the answers. And if you haven't tried chiropractic, you haven't given it a good look, now's the time. Appreciate Olivia you coming in and sharing that with us.
Okay, my pleasure. Yeah.